Hello everyone, I am Dr. Sunil Shenvi. I am the Chief Editor for DigiNerve Surgery SS course. Today we have Dr. Ramakrishna with us. He has got rank 15 in recently concluded NEET SS examination. Congratulations, Dr. Ramakrishna. So, can you tell us a little bit about where did you do your UG from and PG from, and what is going to be your choice in NEET SS examination? The counseling.
Thank you, sir. My name is Dr. Ramakrishna. I did my UG from Government Stanley Medical College, Chennai. Then followed by that, I did my PG at BJ Medical College, Ahmedabad, Civil Hospital. My dream branch is to take urology, sir. I felt this to take urology in the second year of my post graduation. So that is the time I decided to go for it, sir. And I'm very happy to get this rank. I thought what the efforts I have kept means prepared for that, and I got that rank, sir.
Yeah, hearty congratulations. It is a very great rank, and I think at rank 15 you can get anywhere in India rank your urology seat. I think. So,
Yes, sir.
can you tell me? So, when you how did you hear that you got rank 15? Like somebody told you, or you yourself checked it? How was it? And how did you feel when you realized that you are rank 15 in NEET SS?
Yeah, sir. It was the evening, sir, when I got the this thing in all groups. We used to be there, sir. In that
Okay.
groups, the result was directly flashed like PDF file was come. Then
Okay.
immediately I was going through my. I didn't remember my roll number, sir. Actually, roll number I
Okay.
just opened it and I was just going from the back. What rank I'm because some silly mistakes I have done, sir. Many around 6 questions, which I thought
Okay.
I will be thrown out from the competition or something because the question paper seemed to be easy, somewhat moderate to moderate level, and some silly questions were there which I thought I have done wrong, so I thought I will be in 300 or something like that, but luckily I was in rank 15, sir. I think other people also might have done some silly mistakes, I think so,
Yeah.
like that. And I was really very happy, sir. I was shocked, and again I asked my wife also, please please check the roll number once. Then again she told, no, no, it is your rank only, don't worry. That time I got little confidence, sir.
Anyway, congratulations. So it was a great news, I am sure. So tell me, when did you start preparing? Like, did you prepare for like last 3 years or last 2 years or just 2 months? How long you have been in your preparation?
Sir, actually, in the second year last, around third year, in the beginning of third year of residency, I started my preparation, sir, and it was very well planned and structured how I prepared actually. I know that I have to do super specialty, and along with that, I have to clear my specialty exam also with good rank, means with good marks, I thought. So I started making notes, seeing the videos and all. Followed by that, after every chapter ends, I used to leave around 5 to 10 pages, sir, blank pages, and after that I will start a new chapter. And I have a habit of making my own notes, sir, because the visual memory will be very good. When while revising it, you can revise very fast actually. And where there is a conflicting points are there, I certain times I used to refer to other books also, and I used to write like a short notes in the book itself to make the concepts more clear.
Yeah.
And I used to write little spaces also, because in the after solving MCQ, if any point needed, so that I can add on there. It was there. It was like that, sir. Around 3 to 4 books I made, sir, after writing all notebooks. And I cleared after that. Specialty exams cleared. And for super specialty in SRship, I was highly focused for super specialty, sir. Whenever I used to get the time, I used to prepare, sir, because my notes is almost ready. In super specialty, another last in the beginning 2 months again I was into, because certain topics I left in the third year. So those topics I have made my own notes. Then I started revising those things, sir. And while revising, if any point, I used to solve questions also MCQ. In the question from the question bank, any new point comes means I used to add on the notes, sir.
Hmm.
So okay, like that, my notes become highly. In the end, my note has got almost all the points, sir. So
Yeah.
it becomes very easy to revise, because certain topics, we have to keep on revising. Otherwise, it's like very volatile, sir, because certain values, if you're reading, and 100% to recall, no, sir, it becomes a very problem, because in the MCQ, we have one question for 1 minute, 150
Yeah.
questions, 150 minutes. Unless we are prepared very well for the race, to recollect the question, to recollect the theory associated with the topic becomes difficult, sir. So we have to be fully prepared with revision, sir.
So you were just mentioning to me, no? So which books did you read, no? The standard books, or did you read any other books? Which were the books which you used for preparation?
Sir, nothing new. Belly and Love, line to line, I have read, sir. Belly and Love, except the parts like ortho and ENT topics which are there in Belly and Love. I didn't. I just had a single time I have gone through it. And other topics are thoroughly I have gone through Bailey and Love. Sabiston, like images of Sabiston, I have read, and all the tables I have read from Sabiston. And Schwartz also, sir, I have just seen the tables and the images, sir. All the images of Bailey and Love, Sabiston and Schwartz. I have taken the screenshots of images in my phone like that so that I can revise whenever I get the free time, sir.
That's a good strategy. What was the toughest phase of your exam preparation?
So toughest ways like sir, it's easy if you see 150 questions in the initial grand test when I used to give, it is easy to get from 90 to 105, sir.
Yeah.
When 105 questions once they become correct, it becomes difficult to reach from 105 to 110. Either you need repeated revisions or you may be lacking somewhere, which we may not be knowing. And we have to go through those topics where I'm getting negative or some lacking is there, lacuna is there. Or I am finding it difficult in connecting the dots, the knowledge what I was having. I was not able to connect the dots, or I was not able to come to a conclusion in the question, or some confusion is there. So that time we will correct those topics basically. And after 110, it's like you need thorough revisions. Automatically, it going to jump up, sir. It's like that, sir. So the toughest
Okay.
phase, I feel that. And another thing, sir, certain times we all senior residents, you have postings and all at the same time you have to prepare. So you have to make your brain that means I have to psychologically we have to think that okay, today is OT, evening I will finish this topic, and I always, sir, whenever I plan my schedule, I always used to keep a gap of 3 days. In this month, suppose I'm making a schedule, I have to prepare this. Then I used to keep a schedule at the end of the schedule, 3 days, sir, spare days,
Yeah. Yeah.
whatever left, so that I can cover. And
Okay.
another thing I used to follow, suppose today I have read this topic today. After 2 days, I will solve the MCQs of those topics.
Okay.
Because today, if I study, if I solve MCQ, it will be very easy because
Yes.
your
Yes.
memory is full of those knowledge.
Yeah.
After 2 days, it slowly fades out. So
Yeah.
what will happen after 2 days? If I solve those MCQs related to that topic, I can. It's like second revision for me.
Correct.
So
Correct.
it enhances the recollecting ability, sir. Actually,
So how much gap was there for your theory exit examination and for the NEET SS?
so it was almost 7 months, 6 months, 6 to 7 months was there around.
Okay, 7 month gap you had to prepare, and that's
Yeah,
when
sir,
you could
and along
revise
with senior
everything.
residency.
Yeah. So at that time you can revise everything.
Yeah, sir.
Yeah.
I-
So Dr. Ramakrishna, you told me that you have used our app, DigiNerve app. Can you tell me what did you like in our app? What are the features which you felt are very helpful to students?
Yes, sir. During residency, I have come across this DigiNerve app, sir. The unique features of this app is like we means it's not preparing just for the competition. You are preparing for the residency also. And as JP publication, so many books are there, and the preparation like long cases video we have in your app, which helps us to prepare for clinical examination also. What topics has to be covered in long cases, and exactly though I think those are the long cases which are needed in the entire country. Basically, we see. And short cases also are there, and clinical examinations, sir, which is important because certain times, certain cases we won't see. So we don't know what to mention. Certain books, if you see, like S Das also, which basically we read for clinical examination. Other books also lack those clinical examinations or certain things, and that are important for the university also. So those clinical examinations portions were very well covered in the Dizzy now, sir, and the surgical skills and instruments topics were also there, which we have seen in the last, sir. And surgical tools also was there. I think means that thing also was there, and OSCE was also there, sir, which is very rare in
Yeah.
any app.
Yeah.
And questions were good enough key, like covering almost all the topics, sir.
Yes.
Almost all questions I haven't solved from this, but grant tests have gone through this. Grant tests I have given of DigiNerve, and I prepared mainly for this university examination, sir.
Yeah.
That plus or minus helped me actually in the this competitive exam also, because topics are almost same only.
Yes. Yes. So what like all of us, what we feel is what they ask, they're going to ask in theory is different, what we practice is different, and what comes in NEET SS is different. But if you see, it is the same topic, what is clinically relevant, same thing will be asked in your theory examination. And even in NEET SS or INA SS, same points will be made as MCQs and
questions.
asked. So there is a continuum in all these things. I think now you can appreciate that point. Yeah.
Yeah, sir.
So tell me, like you have been telling that you practice lot of mock tests and all. So how many mock tests, like how many MCQs everybody has to solve every day, and how many mock tests you need to give before you give your NEET SS? This is a common question by all the students.
Yes, sir. In the last, my strategy was like I divided again the topics, sir. Means in 2 days I will finish this portion, like general surgery,
Yeah.
and after that I made a means I made particular schedule, sir. After this I had to finish. After 2 days, these questions I am going to solve. In between, I used to keep a timing, sir. Like morning, I have gone through topic 2 to 5, 2 to 4 around, sir. I used to give exam daily afternoon
Okay.
because I have a habit of sleeping in the afternoon, but our exam will be in afternoon only.
Yeah.
So last 3 months I stopped sleeping in the afternoon, sir.
Okay.
Afternoon nap, and I
Yeah.
started like 2 to 4. I used to give exam,
Okay.
and after that I used to again revise, sir. Start revising.
Hmm.
So it was like per day I used to solve 100 to 150 questions, sir. Before that, already I have gone through basic questions, sir. Of all the question bank I have solved. So the
Okay.
question bank points were already in my notes. So
Okay.
nothing new. Suppose some clinical question is there, which I think it is very important for me to see in the last. Then I used to bookmark that question only, sir.
Yeah.
So I have very less bookmark questions in the end, so that it was very easy before 2 days to go through it, sir. First point for me.
Okay.
And
Okay.
almost which are the MCQ points which I have not, which is not there in my notes, I have already added because 5 to 10 pages I have left after every chapter for adding into it, sir.
Yeah.
So almost I think I have covered. Almost I think if you see almost question bank from in and around, I have solved 10,000 to 13,000 questions, sir, MCQs.
Okay.
And almost overlap will be there. While
Yeah.
solving a grant test also, mostly those MCQs will be there covering.
Yeah.
Maybe asked in a different clinical scenario.
Okay.
Concept will be same only, sir.
Yeah.
And another thing, sir, I in the grant test, like it will help us to, sir, to know where we stand actually. So grant tests and mock tests are very important, I think, because student will be knowing where we stand in the competition actually.
Correct.
So
Correct.
which is very important, and it will tell us ki what else we need to add and what portions are lacking when overall questions asked from all the chapters of the book. So what is our level actually? Certain topics we will be knowing very depth, certain topics will be superficial. Maybe our not the way we prepared, maybe having less knowledge. Like sir, nowadays, if you see lymphatic system, the topic is not there in Bailey and Law
Yeah.
22nd
Yeah.
edition. So, but
Yeah.
lymphatic system is an important thing because the topic always procedures and all you questions used to come. So
Yeah.
that we have to refer from Sabiston, any other book where it is there. Like old edition of Bailey has got that topic completely. So like that, sir.
Yeah. In our
And
app,
almost
actually,
grant
we have
test
covered
30,
lymphatic system
30
in the
grant test.
app, no? In our app, the lymphatic
Yeah, sir.
system has been covered by the plastic surgeon, Dr. Vittal. So he has covered it in detail, the lymphatic system.
Yeah, sir. In
And I
detail, it was
understand
there.
it's a very important topic for exams also. So, how
Yes.
was your last month preparation? How did you prepare for the last month, 1 month before the NEET SS examination?
So last month, it was like anxiety was there because it's quite common, sir. And as I told in other people also, like once we are prepared, anxiety will go down. And
Yeah,
once you start getting good ranks in the grand test, the anxiety slowly goes off, fades off.
yeah,
And one thing is, unless means anxiety, too much anxiety will come when we are not prepared actually. So
yes,
once you are prepared, okay, I'm getting granted this much, that will slowly bring the confidence in us, sir. That
yeah,
confidence is very important.
yes,
And one thing I will tell, sir, in the exam, those who are preparing, we should have a mindset because the exam paper is divided into three sets,
yes,
like 50, 50, 50 questions.
yes,
And once 50 questions are solved, you can't go back.
yes,
That exam section is going to be locked. So we have to prepare, like I have to give 50-50 questions. Three sections are there, but it's like three exams only. It's like random questions only. So first 30 questions will be easy, sir. Around 30
yes,
questions are going to be like straightforward kind of thing, or they might intentionally convert it to clinical like that.
Yeah.
and rest 15 questions will be moderate to little tough,
Mm-hmm.
where we have to need to spend more time. Five
Yes.
questions will be tough on an average. So what I will tell all the students, if you people see the questions, if it is tough, you just leave, give a single line, single time you just go through it, then go to next question. Don't waste time in that. 50 questions you can easily go through. 30 questions will be easy. In a single reading itself, you can put tick. Don't think that much. Then the time that is remaining, suppose 30 questions we are able to solve in around 25 minutes. The rest 25 minutes, please utilize for the moderate to high level questions. If after solving 30 questions, we will get a confidence, sir. Yes, I have done 30. Without
Yes.
losing the confidence, if we attend those 15, in that almost 12 to 13, if we apply brain logically by ruling out the options, we can easily do it. Once we have done that, again a confidence level raises, and you with recollect and all, with that confidence, you can attack those remaining five questions. So I will tell to not to get stick to single question, because once in the beginning itself a big question comes up, and if you lose the confidence, it will affect the recall also, sir. Because you will, once we lose the confidence, you will get anxiety, and the recall, everything gets affected. So I don't want the students be relaxed. Just okay, this is there. Okay, next question, next question. Okay, I have left this much. We have bookmark option is there. Then I will revisit, because certain times we have just read the question. That time I may not recall my brain. After 5 to 10 minutes, a recall will come. Okay, that was the option. So that will help us again in recollecting while going through those questions, sir.
Yeah. So how did you feel this time NEET SS, the level of difficulty? It was like it was like your preparation, like what difficulty you anticipated, or it was more difficult, or it was less difficult? What was the difficulty level?
Sir, it is moderate only, sir. It's not difficult, we can say. But the question was like little bit they're twisting. Nowadays, they're more into clinical, sir, because that's what I'm telling. Because DigiNerve has got that clinical exposure to the students, because the things are changing nowadays, the pattern. And in the upcoming days, there are no direct questions, sir. Last
Yeah.
year, along with my residency, I have given that time. Along with my residency I have given, that time I got with the residency when I have given, sir, that time I got all India rank 400. That
Okay.
time the situation was like questions were pretty direct. I don't know, from
Yeah.
this year the pattern has changed, I don't know, sir. This year the questions were completely clinical, sir.
Yeah.
That is the time what the students are generally facing the difficulty. It was like that, sir. And one thing I will suggest, keep when we are preparing itself, while I reading the Bailey and Love itself, I used to make question by myself, sir. Okay, if this line has to be converted to question, what they are going to ask. So
Yes.
by the moment you will read Bailey and Love, you might have solved many questions, sir,
Yeah.
by creating question, because we are not kids, we can't make. So by reading itself, we can create. Okay, this can be asked in this way,
Yes.
and also we can able to remember more also, sir, in that way.
Correct, correct. So basically, Belly and Love is like both Belly and Love and Sabiston. They are the most condensed version of surgery. So every line can be made as a textbook. And
Yes,
other
question.
thing is, I understand that nowadays all the questions are from clinical standpoint. So that's why,
Yes,
like
sir.
in DigiNerve, most of the people, all of us who have given lectures, we are all practicing clinicians. So whenever we teach something, we know what's the clinical application of that line, and then we try to teach you know why it is important. Though, but every line in Balian Love and Sabiston is important. You have to remember everything. So,
Yes, sir.
what is the advice you will give it to all these future NEET SS aspirants? What mistakes you did, and you don't want the future aspirants not to repeat those mistakes?
Yes, sir. I will tell, means once we have decided that we have to go to super specialty, I will tell every resident that we have to prepare for it, because the exam is not like, because everyone is going to write, and every year students are increasing,
Yes.
and we should be aware of that. And it is better to start early preparation. For the DigiNerve will is the, I think, is the only platform where we will get exposure for both to clear the residency also. Along with that, we can clear the competition also. So it will be a good partner. I think DigiNerve will be a good partner when we are preparing, because residency points are also very well covered, along with the clinical examinations, long cases, short cases, clinical surgical skills, surgical tools. So many things are there. And and it will be easy also to go through. Once that is over, then directly shift to question bank preparation and videos, whatever topics needed. So single platform for everything, one thing. And another thing I will tell the students ki while preparing, uh, we have to solve as much MCQs as possible and go with the guts, while options don't change options in the last. And I have done that, and I attended 6 questions, I got silly questions mistake because of that. Don't overthink. And certain time, because of overthinking, we get caught. And when there is a long question, the examiner may be fooling us. So in the long question, just read the last line, what the examiner wants to say, then just go through options, then you just read from the above. The moment we start reading from the above, sir, many points will be thinking, okay, this given, this that may not be needed. In the
Yeah.
last line, they might have asked, what is the management for this patient of a
Yes.
tension pneumothorax? Most of the time, they write the diagnosis also in the last line.
Yeah.
So management of tension pneumothorax, options will be there. That
Yeah.
can be asked in a single line also.
Yes.
So simply they want to get the student to get caught in the above 4 5 lines. So I want the students, in this way, what will happen? The suppose we are spending 1 minute in that question can be reduced to 30 seconds.
Yes.
So I want that to we can save time in that way. And uh, like 50 50 sections I have told, they have to go through it. And in the revision is very important, because revision will make you more confident, and revision will make you to attend more questions, because your recall will be fast. For recall, you have to do revision, there is no alternative. And
Yes.
hard work will really pay off, sir.
Yeah.
It's like all small steps, you have to maintain the confidence, and you have to daily discipline, and discipline is a skill, sir. And we
Yes.
have to learn the discipline. Cut the social media time, which is very important while preparation, because we don't know social media will eat away a lot of time, sir. I have told other people also, just 20 minutes per day. If you see, if you are using 3 times in a day, 20 20 20 minutes, 60 minutes, that if you see collectively in a year, 300 days, if you see 15 days are gone in the social media itself.
Yeah.
So it's a dangerous thing which we don't know, but it on the law in the large scale, if you see, it creates a big impact.
Yes.
And I want students that like senior residents and all those who are working also. It's easy to crack. It's not that difficult super specialty. It's just perfect guidance, perfect solving, perfect strategy. It's very easy to crack, and we will get the desired field. And I want those who are getting the desired field, suppose if they are getting DRNB also, not to get demotivated, because at the end we all in the coming to same platform like clinical practice. So
Yes.
DRNB just take and have the finish and 1 year to do practice where a lot of cases are there, suppose. So there is no point of sitting back and preparing again unless you
Yes.
are not getting the desired field. I don't want anyone to change the desired field just seeing the ranks, because at the end the college won't stay. At the end our field only stays with us.
Yes.
Just because of rank, I don't want anyone to change.
Yeah.
That's all, sir. All the best to everyone, I can say, sir.
Yeah. So basically, you are saying that consistency is the key. Like, don't
Yes.
just prepare at the last moment. Keep preparing for all 3 years, and then don't be overconfident. Don't be underconfident. Be confident.
Yes,
I
sir.
think that's what you want to convey to the people. Okay, so
Yes, sir.
that's it, Dr. Ramakrishna. So excellent rank. Good luck to you. I'm sure you will do very well in your urology and in future. So
Thank you, sir.
thank you so much for your time and giving this valuable advice to all future students. And